Welcome to Watch Your Mouth, the podcast series by the Ministry of Health and Wellness Oral Health Unit, where we dive into the essentials of oral health and how it impacts our lives. I'm your host, Dr. Chanel Dempster-Peart, and today's episode is all about the unique world of pediatric dentistry. Parents of little ones, this episode is for you. Our guest is Dr. Natalie Wolfe, a dedicated dental surgeon from the Bustamante Hospital for Children, who has had years of experience caring for young patients. Dr. Wolfe will share insights on everything from the importance of early dental care to tackling common childhood dental issues like cavities and gum disease. We'll also discuss ways to make the dental experience less intimidating for kids and set them on the path to lifelong healthy smiles. So if you're a parent, guardian, or just curious about the essential role of dental care in a child's development, you're in for a treat. Let's get started with Dr. Wolfe's expert insights into pediatric dentistry. Dr. Wolfe, thank you so much for joining us.
Thank you for having me.
Good. Can you explain why baby teeth are so important, even though they eventually fall out?
Okay, so we need to recognize that God made us a certain way, and our baby teeth are supposed to stay there for a certain length of time. When we have to remove them too early, we end up with problems with the permanent teeth, such as crowding, because the baby teeth actually guide the permanent teeth into place. So when we remove them too early, the permanent teeth become crowded, and then that requires another type of treatment, orthodontic treatment, to straighten the teeth and balance the mouth out. Our mouth is always in balance, so when we remove teeth too early, teeth start to shift, and that creates other problems.
And while they have these baby teeth, they're important for the child's self-esteem,
Correct.
I imagine.
Correct. Children who have decay, especially to the front where they're in their smile zone and smile line, when they're at school, they can be a little bit conscious if the teeth are like black or dark in color, and they can be teased sometimes. So it's important that parents do the right thing and take care of the baby teeth, because it can end up with swellings, pain, loss of school hours, a lot of things that can be negative for the child's experience as they grow.
In an earlier episode with Dr. Andrew Phillips, we saw a very horrific image of dental decay among children. What are some of your worst experiences with children's teeth?
I would have to say a lot of the children who we manage at Bustamante come in with really bad carious lesions. Some of them have to be admitted because of the swelling to be placed on what we call intravenous or IV antibiotics. That's antibiotics through their veins because the swelling is so bad. Some of this swelling, we may have to go in and drain the infection. So I've had a child, I remember some time ago, who had a cavity to her permanent tooth, her anterior upper tooth, and we couldn't, even with the antibiotics, we couldn't understand why she was having these constant headaches, and she was constantly having a fever. We couldn't break the fever. And we sent her to do a CT scan, and she actually had a brain abscess related to her carious permanent anterior tooth. And we had to call in our neurosurgeon to actually drain the abscess to her brain. So your body is a whole. You know, your teeth aren't separate from your body.
Yeah.
So everything can affect something else in the body. So it's important to manage caries and to manage it properly.
And to prevent it, I'm sure you would want them to also not reach to the stage where infection is spreading to the brain.
Correct.
All right. Caries is a big one, but I know too that trauma among children can also have an impact. What's the most common mishap that you've seen in children's teeth as it relates to trauma?
Okay, so for our younger children who are just learning to walk, they fall a lot, they hit their front teeth. So you'll have a lot of children, you may see them with little dark front teeth. That's related to trauma. Some of them have what we call avulsion, so they actually lose the tooth. But I think the most common thing would be fractures to the enamel, which is the white portion of the tooth, or concussions. So when that happens in the baby teeth, we don't reimplant baby teeth, okay? So the child will have to grow without the tooth until it's time for the permanent tooth to come down. It becomes a little bit more serious when the child has already changed their teeth and they have their permanent tooth, which is now avulsed, meaning they have knocked it out completely, or fractured to the point where they may need the intervention of a root canal.
So fractured meaning there's a break or a chip in the tooth?
Correct.
Okay.
But you have different types of fractures, and so that will relate to the seriousness or determine how you manage the tooth.
So I imagine that since there are different fractures, it would be hard for the public to know what exactly to do with a chipped tooth, and they need to see the dentist. But tell me, what happens if a child chips a baby tooth?
So depending on the age of the child and the severity of the chip or the fracture, the first thing is that you always want, any form of trauma, you always want the child to see the dentist, because we do get a lot of the times where mommy says or daddy says, oh, they fell months ago, or they fell last year or 2 years ago. Did you see the dentist? No, they just fell and hit the tooth. But now, 2 years later, there are signs and symptoms of this fall, the tooth becoming dark in color or the fracture becoming worse, okay? So it's always important that once a child falls and hits their tooth, that they see the dentist so that it can be monitored, it can be evaluated, it can be repaired if possible, and we can follow this child as they grow to see if there's any serious intervention that will need to be done after, months later.
Okay, and that's for baby teeth and permanent teeth?
No, for permanent teeth, no. Generally, those can be repaired depending on the type of fracture.
Yes.
But the permanent tooth, you normally have to assess the tooth for pulpal involvement, which would require further management, just as opposed to just a restoration. And we also have to understand that the effects of a trauma to a permanent tooth will not manifest immediately, but years later, then there may be signs and symptoms related to that earlier trauma.
So children, adults, permanent teeth, baby teeth, the message is that these persons need to visit the dentist
Always.
as soon as they have the injury to see whether or not it includes the pulp or the nerve of the teeth, and if they need to get fillings or more extensive treatment.
Always, that's correct.
It sounds like a lot will happen at that dentist visit, and many children, their parents too, end up being nervous about the dental visit. What are some strategies that you have in place or would recommend to parents to help lessen those fears?
Well, with the advent of YouTube and all these ingenious things, I think that you can always find something to, prior to the appointment, to teach the child about visiting the dentist. So parents have to have frank conversations with their children, regardless of the age. Find something age appropriate to teach them what happens when you go to the dentist. I think that you need to use children-friendly words so that they won't be nervous. And it's basically about conversing with the child and explaining what procedure will be done in a way that they can understand.
And the other side of it is that sometimes parents need not tell them too much. What do you think?
Well, I think that what we don't want them to do is to associate the dentist with negative experiences. So if they're going to use that as a form of punishment or a punitive form, then that's going to be an issue. So things like, if you don't behave yourself, I'm going to make the dentist juke you, which we hear a lot. That's a no-no, right? We don't want children to come in with the fear that they're going to be injected for everything.
Yeah.
Right? So child-friendly words. And the other thing that's a big issue is not being honest. So if you know that the child will have to come in to get an injection, you need to let the child know that this will happen, but you're going to put it in a way that the child will understand using words that they can understand. Because if you tell them that this will not happen and it happens, that's going to be a problem for the child.
Yeah. So trust is important,
Very
and
important.
building an environment. At home, is there anything around oral hygiene, toothbrushing that could be done to help the child when they visit the dentist?
So I believe in building healthy habits. And so the child must understand that there are certain things that we have to do. Brushing the teeth is one. And brushing not only in the day, but at nights before going to bed. That's very important. So mommy or daddy has to be there. They have to be there to help with the brushing. Okay? Up to sometimes age 10, they need to check that mouth to make sure it's properly brushed. Because you send that child into the bathroom and say brush, and they know that their iPad or their tablet is sitting there waiting for that game to be played. And they're going to go in there and they're going to brush for 30 seconds.
Instead of the 2 minutes.
Instead of the 2 minutes that is required.
Yes.
So mommy and daddy need to be there to help brush, to ensure that the technique that they're using is the proper technique, to help them to floss, to introduce that. You have to make it fun. You have to make it games, especially for the little ones. So you allow them to brush initially, and then you take the brush and you brush properly. Make it a game. Get your little timers and use that to ensure that they're brushing for the 2 minutes that's required.
Okay, Dr. Wolfe. For the children who are changing teeth, what age does that usually happen again?
So generally, we start changing the lower anterior teeth at about age 6.
So the lower front
This lower front teeth. I have seen it happening earlier at age 4, but generally it's about age 6. They start shaking.
And what other signs that will let you know that teeth are changing? So shaking.
So the biggest one is shaking. And sometimes with the shaking, you can have pain on eating. So parents have to be aware that, you may have to change the diet a little bit to accommodate. We don't routinely just take out shaking teeth because you don't necessarily want to have to put the child through an experience of using anesthetic, meaning injecting them. So sometimes we allow them to just come out on their own unless it really is problematic for the child to function.
And then some come towards the back without any shaking at
Yes,
first.
and so we have to be very aware, parents have to be aware, because that tooth that comes up to the back on its own is a permanent tooth. And so that tooth needs special love and care, and we don't want that tooth to decay. So parents, you have to be very aware of that, and you have to make sure that the child is seeing the dentist so that the teeth can be protected and we can try to prevent the cavities.
You've said that some persons are a little earlier than that 6 years, as early as 4.
Yes.
The other end of the spectrum, teeth are not falling out, teeth are not shaking as yet. What should parents do if they reach age 6 and they're not seeing where their child has
Well,
lost
I
anything?
wouldn't panic, and I wouldn't hold the age and say, okay, it's age 6 and we're now at age 6 and nothing is happening, because things happen when the body is ready, right? So if you are concerned that you've passed age 6, age 7, then you need to take the child to the dentist. Maybe some x-rays need to be done to see where the permanent teeth are. Because what happens is that the permanent teeth comes up under the baby teeth and resorbs the root. No.
Breaks it down, resorbs?
Exactly. So that's why the teeth start to shake. No, we do have some cases where you have permanent teeth that are missing, and we call it congenitally missing teeth. So those teeth have not formed, and so the baby teeth will be there, right, and not shake. So x-rays or radiographs will be a good way to help with diagnosing if they're missing teeth, right? So everything you always have to come to visit your dentist.
Visiting, and that's twice a year
Twice a year at least.
Can you explain to us then what the typical timeline for development of permanent teeth is, and what should parents look out for throughout this process?
Okay, so that question is a little tricky when you talk about the normal development of permanent teeth.
Mm-hmm.
So you have children who may not have enough space in their mouth. And so what you have happening is that the permanent teeth are coming up and the baby teeth are still there, right? Um, and in that situation, we may have to remove the baby teeth to allow space for the permanent teeth to come in properly. But there are situations also where removal of the baby teeth may not be enough, and those children will need to access services from the orthodontist, right? Because they may just not have enough space in their jaws for the teeth to come up in a proper fashion in a straight line. So that's why an assessment at your dentist is important, so that if you need to be referred for orthodontic treatment, you can have early referral and early intervention.
Okay. We spoke about when the permanent teeth will come in. Let's backtrack. When will the baby teeth come in on average?
So what I would want to tell you is that as you see the baby tooth coming in the 6 months or so, that child needs to get ready to start seeing their dentist.
As
So you have
early as 6
as
months,
early as
Doc?
once the teeth start to erupt, that child is ready for their dental visit, right? And I also think that parents need to understand that a lot is happening in that antenatal period in the womb when the teeth are developing.
Mm-hmm.
So during their antenatal visits, I feel really strongly that we have to have some kind of integrated approach to treating or managing our parents.
So while mommy's pregnant, you're saying that what's happening during that pregnancy is affecting baby's teeth?
That is correct, right? So I feel that midwives, obstetricians, first point of contact, they also need to understand how oral health is affected through pregnancy and the development of the baby teeth, so that they can be advising their patients on what needs to be done. Because it's not only looking at the mother, but the mother also needs to understand what is happening with the child and how to, when the baby is born, postnatal, how to take care of the baby's teeth.
And then postnatal, when teeth start to erupt, they will know too that they should start brushing as soon as that tooth comes in.
Exactly. And also in terms of feeding, because parents, when you have children who are still breastfeeding, while we are not disputing that the breast is best,
Yes.
breast is always best, but we also have to understand that breast milk is sugar, carbohydrates, right? And so if it's left on the teeth, it will decay the teeth. So after breastfeeding, we have to clean the teeth. Even at nights, when you know the child is at the very minimum, you have to wipe the milk off the teeth to prevent the decay and the early childhood caries that we see. And we see that very often.
So baby falls asleep with breast, still go ahead and wipe the teeth. That's what you're saying,
That's
doctor?
exactly what I'm saying.
And for those who bottle feed, the formulas would have the sugar as well?
Yes. So we have to clean the mouth, clean the teeth, get the teeth free of milk before the child is fast asleep.
So we've spoken about baby teeth, we've spoken about permanent teeth. Children go through a lot as it relates to their oral health. What final word of encouragement would you have for parents who are concerned about the way the teeth are aligned and how they're coming out as they're changing? Do you work with orthodontists as it relates to this?
Yes. So dentistry has many different specialties, and so it's important we all work together. When we have situations like this, then we refer our patients to the orthodontist for management of crowding, which is a form of malalignment, or spacing. So you have different aspects that we look for. and we will refer our patients to orthodontist for management.
We had Dr. Susan Gray on Watch Your Mouth podcast earlier, and she would have said that from as early as age 7, the children need to be visiting, and I'm imagining you're supporting that.
That's correct.
All right, Dr. Wolfe, here on Watch Your Mouth, every guest is asked to give one parting word. A last lick, as we say in Jamaica. What's yours?
So my last lick would be change. My word is
Change.
change.
Okay.
And I chose change because I think we need a lot of change in our approach to oral health. Change in terms of how administrators see oral health and the focus that they place on oral health and the importance of oral health. Change in terms of how parents see oral health and the importance of oral health. So if you see a cut on your hand, you don't wait until the hand has to be amputated before you get it treated. So if you see a black spot on the tooth, you shouldn't wait until it's time to extract the tooth.
Yes.
So change is important. Change in terms of, and this might be a little bit controversial, but anybody who drives through Jamaica past primary schools and look at the gates and see all those suites out there. So change in just how we monitor our children, how the risks for cavities are the same as the chronic illness risks. The lifestyle. And cavities and caries is all behavioral and can be changed by changing lifestyle and behavior. And so we need to look at change in our approach, change in our focus. It's very important to focus on chronic illness, but we have to include oral health in that focus.
Yes.
And so change is my word.
I like that word, Doc, change, because as you've rightly explained, so much is taking place in the developing child, and only through change will we ensure that they get good health. For what's a very common childhood illness, unfortunately, dental decay is one of those common ones.
Yes.
All right, that wraps up today's episode of Watch Your Mouth. A big thank you to you, Dr. Natalie Wolfe, for giving us such a great look into the world of pediatric dentistry. From the importance of those early dental visits to tips on keeping our kids' teeth strong, Dr. Wolfe has shared some fantastic insights for parents and children alike. So let's keep our little ones smiling bright and make dental health a fun, lifelong habit. Thanks for tuning in, and be sure to join us again on Watch Your Mouth.